We are here really in the heart of North St. Louis, around one of the homeless encampments. What you see here are just some of the living conditions that people face.
I was outside. I mean literally outside, sleeping in the rain, sleeping in parks, sleeping in airports. But during the course of being homeless, I wound up in hospitals. I lived in the emergency room. If it wasn't for Barnes Hospital, I don't know where I'd be right now.
The problem that we first observed was that we had our familiar faces, our patients that were using the emergency room to solve their daily issues. And we know that it was not good for their long-term health. We could only put a Band-Aid on it and then expect that they would return. It was also not good for an overcrowded emergency room, which many urban emergency rooms are experiencing.
In my role as a physician, as an emergency physician, pretty much everybody throughout the greater St. Louis region, the Midwest, they're potentially patients. And I always want to be prepared to understand their needs, to be able to address their needs and help them. And the hospital housing program is giving me insight how to help those in sometimes the furthest margins of society and pull them back into the fold a little bit.
We really started hospital to housing 5 years ago to really help people just like this who needed to be connected to housing and to other services.
Partnership like this is really new for the St. Louis area, where we identified individuals who were using the emergency department for not emergency medical care, but they were there because they had no place to go. They needed social service type care. To take somebody from that setting and putting them into housing is so important.
And every single person we move out of homelessness into permanent housing is a huge win for everybody.
That's so great.
When you start to get success with our community, other community partners step up and want to be part of that success story as well. Another key partner that has stepped up is Live Sober Living. And they help us with a special population of patients that may be dealing with substance abuse disorder, as well as being unhoused, as well as maybe dealing with other psychosocial issues.
Well, I was having what I would call a nervous breakdown. There was something in that night that somehow I was led to Barnes Hospital by the grace of God.
Okay.
And they're good people over at Barnes. And they saw me and held me for a while, and they fed me. And they made arrangements to bring me here to meet you guys.
When I think about the work that you do, it moved me so much. I'm so happy that your organization is part of the hospital to housing program.
Getting them access to services.
Absolutely.
You guys recognizing that the hospitals can't always serve the substance use and mental health population.
Yeah.
And how do you feel like that fight for your recovery is going the last week since you've been here?
Oh, it's been great. I mean, these past few days has really been good.
Good.
I mean, I get out and I'm actually having conversation with people. The concern you guys bring to the table and everything and the help that you guys bring is really amazing.
The patients in the hospital housing program, they don't need to come to the hospital for their non-clinical needs. So consequently, that frees up space. They're off our clinical grid, they're well. So it's very inspiring to know that there's an opportunity for everybody and you don't give up.
It's clear that by reducing utilization by 50% in some cases, the patient benefited, but the system of care also benefited.
Patients that you guys are referring, rather than going back to the ED, they're calling us. I can see where the reduction is happening because instead of, oh, I gotta go to ED, that's, because some people get caught up in their norm.
Once you become homeless, that's a pattern within itself. Within your first 30 to 90 days, you don't know how to live, you don't know how to do anything. Well, this program teaching me all that all over again. I mean, being able to shower, being able to cook, being able to stick the key in the door and come in as you want when you get ready. Those are things that are important. They're training me on how to live again.
These are people and these are real lives that we're able to rebuild. We are actually shifting the narrative and supporting programs that really have a meaningful impact to do community good.
And when we succeed together, we build trust, we fulfill each other's missions, and we help our community improve their health status.
But the most important part, it helps someone like Perry get from the hospital into housing and beyond.